Good afternoon, and welcome to The Agenda, Equality Maine's weekly live broadcast. If you're watching on Facebook or YouTube, feel free to use the chat to let us know where you're watching from and what questions you have. An Equality Maine staff member is monitoring and will make sure to get your questions to us. My name is Matt Moonen. My pronouns are he, him, and I'm the Executive Director at Equality Maine.
And I'm Jake Karras. My pronouns are he and him, and I'm the Grassroots Advocacy Coordinator here at Equality Maine.
And today we're joined by Justin and Stephanie, our ASL interpreters. Thank you so much for your help today. We really appreciate you. And Jake, why don't you get us started?
Sure. So as usual, there's some news we wanted to update everybody about before we dive into today's topic. The big news story out of this week is what's going on at the NCAA. The NCAA has released a new statement on Monday affirming that the organization, I'm quoting here, firmly and unequivocally supports the opportunity for transgender student athletes to compete in college sports. Now, the NCAA didn't explicitly say that it had plans to move its championship games out of the states that enact bans on trans athletes. It certainly did imply that, saying that, again, quoting, only locations where hosts can commit to providing an environment that is free of discrimination should be selected. So this statement happened just earlier this week, and also this week, we've seen both Florida and Texas advancing bans on trans athletes. These two states are poised to hold dozens of NCAA championship games in the next few years, including a large number of March Madness games and in Texas, the 2024 College Football National Championship in Houston. So the timing of the statement certainly doesn't seem to be a coincidence.
Right. Well, good for the NCAA for doing that. All right, well, thank you for the update, Jake. And now we want to move into our primary topic of discussion for this afternoon. And I want to welcome two special guests who are joining us for this conversation. First up is Katie Rutherford. Katie, can you introduce yourself?
Hi, everybody. Thanks so much for having me. My name is Katie. My pronouns are she, her, and I am the Executive Director at Frannie Peabody Center. We are a community-based HIV/AIDS services organization. We have a medical case management program for people living with HIV. We also offer behavioral health services. We have a federal funded housing program for people living with HIV. And we also perform free, anonymous, low barrier HIV and hepatitis C testing, which is supported through the Maine CDC. So of course, the PrEP bill that we're going to discuss today has a big impact on the prevention services and our ability to help people navigate access to PrEP and PEP. So we're super excited about that.
Awesome. Well, Katie, glad to have you. Thank you for joining us. Our second guest joining us is Whitney Parrish. And Whitney, can you introduce yourself? Welcome.
Thanks. So happy to be here. My name is Whitney Parrish. I use she, her, and they, them pronouns. And I'm the Advocacy and Communications Director for Health Equity Alliance. Health Equity Alliance started in 1987 as a Down East AIDS network, providing HIV care services and support to Mainers in Down East. And we grew once we merged with the Eastern Maine AIDS Network to become Health Equity Alliance. We continue our work with HIV/AIDS prevention through medical case management, as well as operating 7 Maine CDC certified syringe service programs, working with people who inject drugs to mitigate the spread of preventable infectious diseases like HIV. And like Katie, we are very excited about the bill we're discussing today and know that it will make a huge impact, especially in rural Maine, where most of our services are provided. So thanks for having us.
Yeah, thank you for joining us. So Jake, let's get started.
Yeah, Katie, I wanted to start off with you. I was wondering, we're going to be using a lot of acronyms here. So could you just start by explaining what PrEP and PEP are, how they're different, and what role they serve in stopping the spread of HIV?
Sure. So PrEP stands for pre-exposure prophylaxis, and PEP stands for post-exposure prophylaxis. So we'll start with PrEP. It's a daily pill that prevents HIV infection. The medication that was approved for use for PrEP is actually the same medications that are used to treat HIV. So they were approved in 2012 as a prevention method. It is just a daily pill. It works for people who, well, it's an extremely effective medication, and it works for people who may be in a relationship with an HIV positive individual and they want to take care of that risk for themselves, and they might take PrEP. It's also great for people who find themselves in high-risk situations and want to make sure that they have that method of protection. PEP is used following exposure to HIV. It has to be started within 72 hours of that exposure, and it has to be taken in full. It's a 28-day regimen. So our job at Frannie Peabody Center is to make sure people are aware of these options in terms of the prevention strategies. And they're incredibly important tools as we look towards ending the HIV epidemic.
Awesome. Thank you for that very clear explanation of what these medications are. So Whitney, now that we know what they are, can you tell us about the bill that we're talking about, LD 1115, and what it would do?
Absolutely. So LD 1115 was introduced by the incredible Senator Heather Sanborn, who has been a real champion on HIV prevention legislation. So we first want to thank her for her leadership on these issues. It did not start with this bill. The bill is supported by Equality Maine, by GLAAD, the GLBT legal advocates and defenders, Frannie Peabody, HEAL, and so many other amazing partners throughout Maine. So what it would do simply in 2 steps. One, require that Maine insurance companies cover at least one HIV prevention drug at the lowest cost tier. And 2, it would allow pharmacists to dispense a 60-day supply of PrEP medication without a doctor's prescription, and would require the pharmacist to connect the client to a primary care provider. There are lots of pieces built in with making sure that folks are tested, that they are having the right function tests done, things like that. And the 60-day supply would allow for that individual accessing easily through the pharmacist to hopefully be connected to a primary care provider, which they could do with the support of folks like Frannie Peabody Center or Health Equity Alliance, because we know there's so many reasons why folks don't have a primary care provider, or they don't have one they can trust, or one who they feel comfortable talking with. And so we think this can be a real game changer in terms of people getting the medication they need when they need it, and then filling those gaps in getting to a provider who can support them with a longer term prescription if that's what's wanted or needed.
Thanks, Whitney. I'll open this up to both of you next. I was wondering if you could just put a bit of a finer point on why it's such a big deal and how it addresses those existing gaps in access to HIV prevention medication.
I'm just going to jump in, Whitney, but interrupt me if you want. Anytime we can expand access to tools that will help prevent HIV is a great thing. As Whitney said, sometimes it's hard to either get to a primary care provider that you want to talk about HIV infection with. Even having coverage is tough. PrEP is very expensive. And so this bill would really help us support people in navigating these challenges, whether it be related to coverage and payment and getting connected to a patient assistance program through the manufacturers of the PrEP medications, and then also making sure that people can get connected to care so that ongoing monitoring can happen. Adherence is very important with PrEP as it is for HIV medications. So anytime we can eliminate those barriers and support people in not only having access, but being able to stay on a medication that helps them stay healthy, is so important. And in Maine, we are a leader in the nation in terms of keeping HIV infection rates low. We're also, we also have one of the highest viral load suppression rates in the country in terms of people living with HIV. So this would just be another huge step towards ending HIV and AIDS, not just in Maine, but the role that we have in the country and globally. And certainly, as we all know, we're living in the middle of another pandemic. So increasing access to these strategies will be so important to the health of all of us.
Absolutely. And, you know, being a provider in rural Maine, so we have offices in northern, down east, and mid-coast Maine. So really sort of far out where medical providers are maybe more sparse. We're in these sort of healthcare deserts, and having this medication available at low or no cost in a straightforward and accessible way really is a game changer, especially for folks who are the most vulnerable among us. Folks of color, folks who live in rural areas, people who have been incarcerated and who may be at risk, people who inject drugs and are working to stay safe as they can. And so we meet lots of those folks in our work. And so, you know, there are all kinds of factors as to why someone might not be able to access this medication. Stigma being, you know, very, I would say probably at the top of the list in many ways, including those sort of systemic breakdowns of our public health infrastructure. So we really look at this as a way to start to remedy that and take, as Katie said, a tremendous step forward in making sure these critical medications and safe, effective medications are available to folks when they need it, which is a really critical point, especially for PEP, given the window in which you need to take it. And we really think, as Katie said, that this is a tremendous step toward ending the HIV crisis that we see here and setting a model for other states as well to follow our lead. It's an incredible step forward.
So if I can jump in, you know, the PrEP right now is in pill form only, but that could be changing. And this bill that we worked on together actually prepares for those changes. So Katie or Whitney or both, can you share a little bit about how this bill is getting us ready for the future of PrEP?
So there's actually a new medication that is an injectable version of PrEP, which would have to be given to an individual once every 2 months. So one of the things we were trying to keep an eye on as the partners were working on advocating for this legislation was making sure that as we look towards the future, and it looks like it could happen soon, that injectable medication is part of this whole plan. And it's particularly exciting. And again, we're used to, especially now with COVID, we're getting tested, we're getting vaccinated by pharmacists. So it's an interesting time in that sense that we're all getting used to seeing pharmacists for this type of care, which thank goodness we have that kind of access. So given that the legislation would cover the dispensing or administration of PrEP for up to 60 days, with this potential injectable coming onto the market, that would mean that a person would just need to see that pharmacist that one time and be all set for those 60 days, and could work with a community-based provider like Frannie Peabody Center or HEAL or anybody that's answering questions at Equality Maine and help and be able to get connected to a primary care provider for that continued prescription moving forward. So I'm glad that we were able to work as a team to make sure that all of those options were covered, because we know that there's not a one size fits all. Everybody needs different choices and options in terms of deciding what's best for themselves. So making sure that this type of strategy really includes that choice is important, and we're excited about that as well.
Yeah, absolutely. You know, given the discussion around adherence and how challenging it can be to even take one pill a day, many of us experience that. You can forget, there are all sorts of different things. So, you know, we're so excited about the innovation happening with long-acting injectables, and it's going to take innovation in places like rural Maine and other parts of the country to be able to support people in the ways that they want and need. Just echoing everything Katie just said so eloquently, and just wanted to expound on a game changer in a game changer. Not to use, you know, I've used that term a lot, but the long-acting injectables, I think, are really incredible opportunity for folks to not have to worry as much about, you know, that sort of daily pill, and get what they need all the same and stay safe and protected.
Awesome. Well, thank you so much, both of you, for providing such clarity in talking about this bill, because, you know, insurance and pharmacist distribution, it can be confusing for folks. So thank you for lending us your expertise. We do want to report that this bill actually got a vote in committee yesterday, and all of us were there watching to see what the committee was going to do. And we're very thrilled to report that a majority of the committee did vote to advance this bill. So that is exciting. There's a little work that the staff has to do to get the bill ready, but we do expect it to get a floor vote in the coming weeks. And this would actually be, we would be the third state in the country to do a bill like this. So not number one, but certainly in the very frontier of trailblazing on policies like this. So before we close, Katie, Whitney, anything that you want to add? Any final thoughts on this work that we're doing?
Just thank you to all of you. It's been wonderful working as a team on this, and we look forward to doing more of that in the future. I'll also just say, while we have people's attention, COVID's been really tough. If you need an HIV test, we can mail you one discreetly. I know Health Equity Alliance is working on the same thing. Maine CDC fortunately supported us with being able to have those FDA approved at-home test kits as part of our prevention program. So please reach out. We will get a test to you. And if you have any questions about PrEP, keep an eye on PrEP 207, which you can access from peabodicenter.org. You can call 553-PrEP and get connected to our prevention program. If this bill passes, it will be such a huge part of our PrEP 207 project, which we're hoping can really serve as a resource no matter where you are in the state to get connected to who you need to in terms of accessing PrEP. So just keep an eye on it and let us know if you need us. Thank you.
Yeah, thank you. Whitney, how about you?
Absolutely. Everything Katie said, we have some incredible resources in the state, and so please, you know, reach out to us, to all of the things that Katie mentioned, and we are incredibly grateful to be able to work on this legislation. You know, the public hearing was on the anniversary of Ryan White's death. It was incredibly moving, and it is an honor to continue this work, to talk about it, to have more open conversations where people are tuning in on Facebook and are able to learn more about, you know, the things that are happening and how they can access them. And so, you know, I'm not in rural Maine right now. I guess I technically am, but you know, from our offices in Penobscot and Washington County and all of these different places where we just have such a lack of resources, we send our gratitude to Senator Sanborn, to our partners, to the committee members, and please stay tuned from Equality Maine, Health Equity Alliance, Frannie Peabody Center, to learn more about how you can support this legislation when it does come up for a vote, and how we can get the word to our legislators and let them know that this is exactly the kind of thing Maine needs and deserves, and that it will be very exciting to be the first state on the East Coast to pass something like this. So thank you for having us, and thank you to everyone who tuned in.
So I was about to let you off the hook, but we actually have a couple of questions from viewers. So hopefully we can tag team the answers to these questions. So the first is, have any other states done such a bill specifically with regard to allowing pharmacists to distribute without a prescription? As I mentioned, we would be the third state to do that. So Colorado and California have done that. And as you've heard, folks are turning to pharmacists for all kinds of things right now, including COVID vaccines. So if those are more accessible to people than primary care providers, let's at least get the foot in the door. I don't know if Katie or Whitney, you want to add anything to that? I've got a second question coming as well. So, okay, so the second question is, what does Maine Care currently cover for PrEP and PEP? Anybody want to go first on that?
So Maine Care does cover Truvada. I don't know if TDF, the new generic of Truvada and Descovy, made the Maine Care formularies. Matt, if you remember from that.
I don't. We might have to look into it.
We had to look that up, yeah.
Yeah, it took a while, I will say, just as commentary, it took a while for insurance companies and formularies to kind of catch up to the fact, because they're HIV medications, for everybody to kind of calibrate to that medication being covered, especially under the ACA as a preventative measure. But I'm probably going to word this incorrectly. I wish the GLAD attorneys were here, but in terms of the mandate of having an option covered, Truvada was the first medication to come out, and that was the quickest to come up in terms of coverage. And then Descovy was next, which was just, I think, in the last 18 months or so. And now Truvada has a generic, but it's not exactly affordable in the way we commonly think of generics at this point.
So it sounds like we need to do a little research in order to answer the Maine Care question. But I can say this, we are very much aware of Maine Care and making sure that it covers everything that should be covered, just like we are with private insurance. Our program director, Gia Drew, sits on the Maine Care Advisory Committee. So we can certainly elevate concerns that folks have to the attention of the folks in the government who run Maine Care. And so please let us know. Reach out to any of us, Frannie, Health Equity Alliance, or Equality Maine, if you have concerns about Maine Care in terms of getting you PrEP. We got another question. Does the bill limit the amount of copays that insurers can charge for PrEP? Anybody want to take that on? So unless Katie, go for it.
So it does require that the medication is covered at the lowest cost share tier. But we also submitted an amendment, and Matt, you can probably answer whether this actually went through, that it be covered at no cost share.
Yeah, there's a little nuance to that. Yes, so it does require no cost sharing, but it requires no cost sharing for one drug for each method of administration. So if you are pursuing PrEP in pill form, at least one version of that has to be covered with no cost sharing. Same for when an injectable hopefully comes online after the FDA approves it. At least one form of the injectable will have to be covered with no cost sharing. The caveat there is that sometimes your provider may want to put you on a different version of PrEP. As I don't remember who mentioned it, but there's Truvada, the generic for Truvada, as well as Descovy. So there's 3 options right now on the market. And if your insurer is covering one version, you may have to go through step therapy or prior authorization in order to get a different version. But if you do that successfully, then that requires no cost sharing. So this gets a little complicated, and I'm certainly not a health insurance expert. So Katie or Whitney, if you have anything to add to that, please help me out, because I know that health insurance is confusing for a lot of folks.
No, I think that's how I would summarize it. And I'm glad you brought up the piece about administration methods, because I think I had mentioned one HIV prevention drug, and that's not necessarily true if there are different ways to administer. And so, no, that's how I would summarize it. And I would echo that there is a lot of nuance to these bills. even the folks working on them, it can get complicated, but hopefully that all made sense, because yeah, that's how I would relay it as well.
So another question, has the bill taken into account possible future CRISPR HIV vaccines? And again, I would invite our guests to comment. I will say I don't know. I mean, certainly preventative drugs like PrEP have been approved at no cost sharing. A vaccine would certainly be preventative if it were to come online. So I would imagine that both under the Affordable Care Act and under state law, there could be no cost sharing required for a vaccine, but I would need to look into that to be sure. I don't know if Katie or Whitney, you want to add anything on the future of an HIV vaccine.
I would just say it did feel like the language in the legislation was very specific in how it defined PrEP, and just that since we don't have a vaccine right now for HIV, I imagine if that came out, we would have to kind of revisit, just depending on what that vaccine looks like, if that would fall within the language of the bill. That's my assumption, but Matt and Whitney, I'm sure more about that process.
Yeah, I think I would just add that, it's something that we will be keeping an eye on, and, what, if and when, hopefully when, because we're hearing all kinds of different things. Though something like that does come on board, we will absolutely be on top of that, making sure that it's accessible to folks, whether that's through this legislation or another bill, if needed, and that, our commitment to building access and affordable access, low barrier access is ongoing. So I think that's a great flag, and something that we will be very aware of moving into the future, because we want to make sure that's just as available as any other formulation.
And my gosh, I mean, imagine a world where that's real, where we're talking about an HIV vaccine. I mean, that would be amazing. And of course, we would all be all over getting it out to as many people as possible, as quickly as possible. So it is 1:30. We are coming to the conclusion of our time. So I just want to thank our guests, Katie Rutherford from Frannie Peabody Alliance and Whitney Parrish from Health Equity Alliance, Frannie Peabody Center, I apologize, and Whitney Parrish from Health Equity Alliance for joining us to talk about this important bill. We will keep you posted as the bill advances, and hopefully we will have good news about it being signed into law very soon. So with that, Jake, why don't you close us out?
Yeah, sure thing, Matt. And thank you both too. I really enjoyed this discussion. My one closing thought on this is I think it's really interesting that this bill is advancing now, when a lot of people, for different reasons, are seeing how awesome low cost, low barrier healthcare can be when it's coming from pharmacists in the form of the COVID vaccine. So certainly an interesting development there too. But enough about that. Certainly, I know there are other big stories that we've been paying close attention to. So along with everything else happening in Washington, we're expecting a ruling from the Supreme Court within the next 2 months on a very important case called Fulton v. City of Philadelphia. And that'll decide whether private agencies that receive public funding, that is taxpayer funding, have to follow non-discrimination law. So aside from being very important to our community, this also impacts what might happen with the Equality Act too. So on next week's episode of The Agenda, we're going to be talking with folks from 2 different organizations who found themselves on the same side of the case for very different reasons.
We will look forward to that. Everybody gets nervous when it's Supreme Court decision time. Our community knows that all too well. So I know a lot of folks will be interested in hearing about that. All right, well, thank you so much for watching, and have a good weekend, everybody.